Hello, and welcome to Medicare Made Easy. This is a regular Facebook Live broadcast that Blue Cross and Blue Shield of Louisiana hosts regularly to share information and health topics of interest to mainly adults 65 and older. May is Mental Health Awareness Month, and we're going to talk about why it's so important for us to check in. It's important for us to check in with ourselves, with those that are close to us, and with our healthcare providers to assess our overall health and well-being. And since we're also coming into the official start of hurricane season, we'll share a few planning and preparedness tips to help you get ready for that event, should it happen. So I'm Dr. Dee Barfield. I'm Vice President of Medical Management with Blue Cross of Louisiana. I'm an internal medicine physician who practiced for many years. So folks 65 and older are near and dear to my heart especially. Mainly my role at Blue Cross is those clinical areas that what I call touch the patient, touch the member. So I'm really glad to be here talking with you today. Joining me also is Ann Booth.
Hi, Dr. Barfield. It's great joining you today. So I am a Medicare benefits specialist, and what I do is I help people that are on Medicare decide what plan is right for them and help them educate them about Medicare as well. Yes.
Well, that's excellent, and certainly we appreciate your help. So I thank all of you for joining us today also. I do want to remind you, if you have questions at any time, if you want to put them in the chat, we will address them. If we don't get to them in our regular conversation, we'll be happy to address them in that chat after the event, should we run out of time. So as I mentioned, May is Mental Health Awareness Month. It's always important to think about our mental health, not just in May, but all year long. But it's become even more significant in the last few years with this pandemic. I think between the pandemic and world events, it feels like we're under stresses that we've never encountered before in our whole lives. A lot of health professionals are even referring to mental health as the sort of second pandemic, because all of the things that are happening with our physical health and in our physical world have to impact our mental health. So we're seeing a large increase in the number of people that are reaching out for help and subsequently being diagnosed as having issues such as depression or anxiety. Even the World Health Organization noted that in the years 2020 and 2021, there was almost a 25% increase worldwide in the number of people experiencing depression and anxiety. And you know, it's easy to throw those words around and say, I'm depressed or I'm anxious. And there is a continuum within those words of things that are just normal anxiety or depression to where it becomes clinically significant or sometimes what they call pathologic. So there is a whole continuum, but I hope as we talk today, you'll maybe become a little bit more aware of if you're someone who's or know someone who's experiencing issues that could be made better. You know, my role as an internist is to make our lives as good as they can be. I may not be able to stamp out chronic things like diabetes or high blood pressure or anxiety or depression, but I feel I've succeeded as a physician if I help you live with those things better. So have the highest quality life that you can have. Now, a particular mental health issue that we see affecting people 65 and older is social isolation. And what is social isolation? It's exactly what it sounds like, kind of being cut off. But that doesn't have to mean it's just because you live alone. It could be something like an impairment in hearing. And so if you don't know people are talking to you, you feel isolated. It could be impairment in your vision. Being visually impaired kind of keeps you from doing some things because you feel like, you might get hurt doing that. It can be, as we talked about, or as I mentioned, being alone and maybe not having access to transportation, not being able to get to places easily. So you find yourself shrinking your world. All of those things contribute to making a person feel more isolated. And especially too, if you don't have strong social bonds, if somebody's not checking on you, regularly, family, friends, neighbors. Again, you're alone a lot more. Fewer, you can talk to your cats, fewer people to talk to, but you end up being more isolated. With that isolation, it's easy to become more depressed. Sometimes you might just call that feeling blue or feeling down, but it can actually be more of a depression. That can lead to anxiety, so you actually become afraid. The less you do, the less you want to do, you become afraid to get out and get around people. So I kind of want to bring awareness to that and let you recognize that it doesn't have to be that way. We've seen a lot more social isolation during these years of the pandemic, and it's especially worse on people 65 and older. You think about all the warnings we were under. Everyone warned us that people of older age groups or with health problems were more susceptible to the physical disease, physical virus. So we tended to isolate them even more, or we became more isolated. And that's why we're talking about it today and trying to bring attention to it. And that's also why it's important to regularly check in on not just your neighbors or your loved ones, but yourself. Kind of say, how am I doing? What is my mood like? So a great place to start, besides checking in with yourself, is also with your healthcare provider. You know, yes, we're eligible for those annual wellness visits, which is at least that once a year check-in. But really, every time you interact with a healthcare provider, it's a good opportunity to bring up your mental health because it is so closely tied to your physical health. And I know we're going to talk about that a little bit more today. Some of the things you might notice in your mood that I mentioned is maybe just not feeling as up. You don't like to do the things you like to do, whether that might be gardening, it might be walking your dog, it might be if you do any kind of sewing or handwork, or you like to woodwork, or you like to fish, or you like to get together and play poker with the guys. And all of a sudden you find yourself going, not today, or not tonight. And then you do that more than once, or you start doing that several times in a row. That's a sign of not getting joy or pleasure out of the things that used to bring you pleasure. If you notice yourself having a sort of a down mood or feeling anxious all the time, those are the best ways I can start to describe it or give you something to start thinking about. There's a lot more clinical terms there, but I want you to have those ways of looking at yourself or your friends or neighbors as a starting point to talk about it. But if we have to have one good thing that has come out of the pandemic, and I do see this as a really good thing, is that there are more options than ever to connect with a provider. And can you tell us about some of those?
Sure. So, with our Medicare Advantage plans, there's virtual and in-person options for mental health. It is so important. I love all the points that you've made so far, Dr. Barfield, because, we need each other. It's truly, truly important. And I talk to so many people every day, and I enjoy that truly. But with our Blue Advantage members, you can have in-person group or individual therapy visits, and depending on, your needs truly. And for those when you can't see a doctor in person, or if you don't live close to a behavioral health care provider, we use our signature telehealth services, which is Blue Care. And so one way I like to tell people about that is it's kind of like FaceTime. If you're used to FaceTime with maybe grandkids or friends or family members, it's like FaceTime. So that's how I explain it to some of my members, because they're not always sure what it means. But Blue Care lets you have online visits with behavioral health providers from your computer, your smartphone, your tablet, or any internet device and a camera. And then Blue Care offers online appointments for behavioral health needs. So if you have just stress. I mean, there's a lot of stress going on. Life transitions. You might have moved from your house to assisted living facility, things like that. That can be really stressful sometimes, but it can be great in the end because you're living around a lot of other people and you get to do more activities. couples counseling, substance abuse, and more. And then our Blue Advantage members, they can use it with Blue Care to schedule a visit with a psychology or psychiatry provider who's trained and certified in telehealth care. So we do send that information in our welcome packets, but sometimes that gets misplaced. So they can visit bluecarela.com, or they can even call customer service and we can provide that information to them. Or if they have an agent, the agent can provide that as well. Or Blue Care, which is one word. There's a mobile app for your Apple or Android device, and you can create an app on your phone to create your account. And it's on the screen as well, which is very helpful. And then they'll be able to log in and schedule an online behavioral health appointment. And there's so many network behavioral health providers around the state who can treat patients through telehealth. And ask your provider about options or check the provider directory for your plan to find an in-network healthcare provider near you. And I just want to say too, yesterday was a very tragic situation. And, even though I'm a mom, I have school age children, and it can affect all of us in many ways. So if that is upsetting you, this is a great way to reach out to somebody, because it might not have affected you personally, but it's still a sad situation. So we're praying for those families, definitely. So I just wanted to say that because it's very sad. So Dr. Barfield, what are some other tips that you have for some of the older adults to stay on top of their mental health?
Thank you, Ann. I'd love to talk about those. As I mentioned, every time you interact with a healthcare provider is a good time to bring it up. In preparing for this conversation today, I actually looked up some statistics, and this one's a little embarrassing. I'm gonna, share the dirty laundry. It appears that even though providers want to ask about the mental health, they might get waylaid and talk about other things and not address your mental health every time you interact with them. And apparently it may be as often as 50% of the time. Now, I think as a doctor, we think we're doing it. When we say, "How are you?" That's a great time to say, "Oh, not so good." But social norms being what they are, we may not always bring it up, and we should. We need to say, "I'm not doing so well. I can't stop those thoughts coming in my head, about all the terrible events that are happening. I can't turn them off. I can't find joy in the things that made me happy. My kids tell me they don't see me smile as often as I was smiling." Those are some signs that you might be struggling with anxiety or depression and need to reach out. One thing, Ann, I appreciate you talking about all the telemedicine opportunities. I will say that the folks I know 65 and older, so many of them have embraced this technology. There might have been a day where folks would say, "I'll never do X, Y, or Z." But I think that what the pandemic has done for telemedicine and using these mobile devices to access healthcare has really taken us light years ahead of where we could have been. You maybe can't do something like remove a gallbladder with telemedicine, but to think you can get help for mental health without ever leaving your home is one of the greatest things that has come out of this. Let me talk about a couple other signs that you might need to reach out for some help. I kind of mentioned them, but if you find yourself trying, there are things you can do to help yourself, and I do want to talk about those. But how do you know you need help? Sometimes, looking forward to that evening cocktail or evening glass of wine, if you look back and you realize that one has become two or more, or two's become four, or if you look back and now it's starting earlier in the day, and it may not just be alcohol that you self-medicate with, it may be food. It may be that, those things that are complex carbohydrates, the cake, the cookies, the donuts, the ice cream, that stuff that you feel good while you're eating it, that feel good feeling doesn't always last. And so you find yourself eating more. And then you might end up kind of messing up your blood sugar or messing up your weight, and that makes you feel worse. And so it becomes a terrible cycle that you've got to break. It's easy to break. You can break it anywhere in that cycle. It's just sometimes you might need a little help to break it, which is why we're talking about reaching out to a professional via telehealth. Other ways that you can help yourself is to get some regular exercise. It's sort of a pet peeve of mine that, every time you turn on the TV or you talk to a healthcare provider, they say regular exercise. And you want to know, what is that? What is regular exercise? It is as simple as walking 20 minutes a day, 5 days a week. And that's considered regular exercise. That amount of exercise can actually be equivalent to some prescription medications that are used to treat depression and or anxiety. So you really could help yourself in some instances. Even if your depression or anxiety needs medication like pills, then I still recommend getting that regular exercise to get a good baseline of physical health. The other things that regular walking does is it keeps you mobile. In many instances, it helps you get out and around people, especially if you're walking outside and not just in your house. So you get that social interaction. It works on your balance. Folks 65 and older, balance becomes an issue, and that fear of falling, and certainly a fear of breaking something. So I'm all about the walking. Now, if you can't do 20 minutes a day right now, I'd ask you to start with what you can do. If it's 3 minutes, if it's 5 minutes, if it's walking from, the back bedroom to the furthest corner in the house, but do that as many times at a time that you can do that. The next day, you might be able to do it in an extra time. So you want to build on what you can do and keep moving. That old adage, if you don't use it, you lose it. I live by that. That's very true. The other thing that we see, and that I mentioned, if you get into those bad cycles, they become self-perpetuating. So you've got to make up your mind. You've got to do mind over matter and say, I've got to stop this today. And so you might need to make that call that Ann told us about. You might need to get up and start moving around. Other good activities for your mental health are yoga or stretching. You mentioned going online. There are good YouTube videos for yoga or just stretches for seniors, people 65 and older. Sometimes just doing a little bit more things around the house than what you've done. All of those things help increase your muscle mass, which then improves your mobility. I also like to recommend getting outside if you can. And I know you're laughing at me. We've just all had this round of storms go through, and some people are still having them. They're probably looking out the window going, she wants me to go out and walk in this. No, I want you to be prudent. But getting outside and getting that daylight has also been shown to improve your mental health. You can go outside, have a walk for about 20 minutes a day, and come back in, and the world seems a little more manageable. One of the mentors that I had used to say, go out and walk your dog even if you don't have one. So that means you just get out there and walk, and you'll be amazed at what you see or hear, and you'll notice the birds singing. You'll notice how the light flickers through the leaves of some of the trees. It really will start to change your attitude. So Ann, talk to us a little more about our health plan and how it can help.
Yes. So I love all those tips. Those are really great.
You're on mute. Yeah, there you go.
Okay. I was like, I love those tips. Those are great. So yeah, our health plan, and you can get so many great tips from what you said too. So Blue Cross and many other insurers, we have programs to help you get more exercise, like you said, and many other services are available at low or no cost at all. So for example, Care Advantage plan, our members get a plan called Silver and Fit. And so what you were talking about, Dr. Barfield, is they can do yoga for free. And so it's wonderful. And there are over 400 plus classes online. They do a Facebook Live every day, just like we're doing. And so there's so many different classes. I know there's some spin bikes. You would be riding like you're in California. So that's pretty neat. I loved it. I did one actually. I wanted to check it out. So that was really great. They do yoga, Tai Chi. If you're not able to do some of those, they do some chair aerobics. So there's many, many classes that are online. So it's wonderful. And then some of the other perks of Silver and Fit that with the No Cost Fitness Center, we have the YMCAs, we have some of the Oshner fitness centers at no cost, and then exercise at home. So we have it's silverandfit.com, so they can go check that out. And then you get to check into your wellness and fitness centers available on your plan. So you get moving for improved mental health. And a lot of them have because it's so hot during the summer, they have swimming pools and things like that. So they can do water aerobics, because I know that's really great too. I wish I had a swimming pool, but yeah, so I know a lot of people enjoy water aerobics as well, because it's good for your joints and everything. So yes. So Dr. Barfield, what else do you have for us?
Well, you mentioned the videos and the opportunities that we have through links and the apps. So now I would offer to everyone, there is no excuse. So even those 65 and older who are still working, there's just not an excuse, because these things are available to you 24 hours a day. So you can fit something into your schedule. If you get home, especially in the winter when it's already dark early and you don't want to get outside and walk, there's no excuse. There's things you can do through online opportunities. So I don't see any questions yet in the chat. If you do have some, we've got a few. Oh, we have one question. Encouraging your parents to talk to the doctors about their mental health, even if you don't go to the doctor visit with them. So great question. There's a few ways to do that. One is, so your parents have a doctor's appointment coming up. You can sit down with them and say, Mom, Dad, let's make a list of the things we want to make sure to address with the doctor. Because when you get in front of the doctor, and sometimes there's that white coat thing and your brain just goes to static. You just hear, and you walk out of there and you only managed to mutter one thing, and it wasn't even the most important one. So I would say make a list and carry it with you. And again, remember, I'm saying we as providers need to be better at asking this every time as well. But the best thing is to put it foremost. And if you as a family member are talking to your 65 or older family member, kind of help them say things like, Mom, I've noticed that you don't seem as happy, you don't laugh as much. I'm a little concerned that this might be something you want to mention to your provider. Why don't you mention it? And let's see, what they say. I don't think I mentioned to you all how closely tied our physical health is to our mental health. Diabetes can be harder to control if we are significantly depressed or anxious. High blood pressure can be harder to control. Similarly, if we are, depressed or anxious. There are some studies that show there's more anxiety and depression in people who are subsequently diagnosed as having cancer. So basically, I'm saying that being depressed or anxious can lower your overall immunity and your overall health status. And so it's important to address those things, recognize it, address it, get on an action plan for it before you just start a terrible spiral that's hard to recover from. And talking to your grandchildren about how they're feeling. Sometimes you can just say, I think the question in the chat is, what can I do to talk to my grandchildren about how they're feeling? And even my own grown children. I would say a couple of ways. One is to say, hey, I saw this Facebook Live presentation on mental health, and it made me wonder, how are you feeling? So use this as a talking point, bring it up. You can also bring up those observations that we talked about. You can say, even if it's, I don't see you all very often, so I don't have a good sense of how you're feeling. Maybe you don't know how I'm feeling. So use those messages to be transparent, open, honest. We can't fix it if we don't know it's broken. So I think we've got to have those conversations with each other. I see that we've got about 5 minutes left, and I do want to remind you that June 1st is the official start of hurricane season. Here we go again, life in Louisiana. And that goes until November 30th. So I know you want to stay tuned to the weather alerts in your area, follow all the guidance from the local officials, consider your health needs. You know, there's a whole checklist about having your medications prepared and things like that. But Anne, maybe you can give us some good tips.
Yeah, so definitely keep your coverage information handy. So I know some people will make a copy of their insurance card when you leave home. Make sure even if you take a picture of it in your phone, the front and the back, but always take that with you. That's so important. And then make a list of your family's health information. So included any of your medications with the dosage and the correct information for your healthcare provider. That is so important. And store it, like I said, on your phone. Keep a written copy in your wallet or somewhere else so that you'll have that information if you have to evacuate. That is truly, truly important. And if you need care or a prescription filled while you're away, that way you can give that to the provider, you know, if you need that. And then sign up for telehealth services. So like Blue Care. So it's not just on the Medicare Advantage side, it is on our individual health sides as well. So check into that if you are an individual member also, like I am. I'm not on the Medicare Advantage side, but I'm on an individual member as well, which we talked about earlier. Or ask your regular healthcare provider about telehealth options, because we want you to be safe when you go away so that you can use those services. So yes. And Dr. D, do you have anything else that we can provide our listeners today or our watchers?
Absolutely. And I do want to thank you for these helpful and practical tips, you know, all part of our being ready for catastrophic events. So thank you. If you do have more questions, please drop them in the chat. I want to thank you all for tuning in. It's what we do, is to try and connect and give you the best resources and become a trusted subject matter expert for you. If you want to share this Medicare Made Easy live stream on Facebook, we will be posting this as a video, and so you can share it. And also it will be on our Blue Cross YouTube channel. I want you to say that 3 times, Blue Cross YouTube channel. But that's also where you can go to our Medicare Made Easy playlist and look at other short videos from other in-house experts that we have. And there's even a Medicare 101 video. You can also subscribe on YouTube, and that's not anything that you pay for. There's a little icon on YouTube that you click and it says subscribe, and then you'll get notified when we post a new video. We will be dropping information on other upcoming Facebook Live events into the comments and more on the Facebook page. And if you even click going, that'll help share it with your friends and maybe get someone else to watch it with you, and you'll have some talking points together. I really do appreciate you all joining us. And Anne, thank you so much. This has been very helpful. And I hope everybody has a great day.
Thank you.
Thanks.